Incidental findings are discoveries of findings irrelevant to the goals of a study. Examples include finding an indication of lung cancer in an X-ray looking for tuberculosis, or finding a brain tumor during a functional MRI scan, or finding atherosclerosis of aorta during a chest X-ray for a patient with wheezing. The Centers for Medicare and Medicaid Services or CMS expects all diagnostic coding to conform to the ICD-10 official guidelines for coding and to conform also to the reporting and rules from Coding Clinic as well. According to Coding Clinic, which a publication of the American Hospital Association, it is inappropriate to report an incidental finding noticed on a radiology report when the finding is unrelated to the sign and symptom, or condition that necessitated the performance of the test for a patient being seen. Systematically looking for incidental findings that are risk adjustment diagnoses is HCC mining. Ensure that your practice has compliant and proactive policies that lead to an appropriate chart review process preventing the intent of HCC mining. Remember that money must not be the clear driver of the chart review program. To consider an incidental finding reportable, most risk adjustment standards require evidence that the incidental finding was pertinent and considered in the current encounters documentation, that is, evidence that a condition was monitored, evaluated, addressed, or treated. The documentation must show proof of the incidental findings such as test result with the date of performance, evidence that the incidental finding was discussed with the patient, and evidence that the incidental finding is being actively managed and treated. The focus should be on the patient's health status by documenting the accuracy of patient's health information, meaning describing the correct clinical picture of the patient so they receive better care.